was a long story of an adolescent girl I had seen about 25 years back. This was an adolescent girl who had fever, high grade fever, nearly for about 10 to 15 days. She had rash. She had generalized lymphadenopathy. She had marked hepatosplenomegaly. She had respiratory distress. Saturation was 90. She had wheeze. She was sick, toxic. Basic investigations for PUO we did. Total count hyperleukocytosis, 54,000. So that made us think of only malignancy or some serious bacterial infection disseminated. Eosinophils is 11, hemoglobin is 11, platelets are 4 lakh. Bone marrow we did HIV, CMV, EBV, viral markers, everything was negative. Bone marrow was reactive. We had no diagnosis, cultures are negative. And this is the rash which was there in the girl's chest. See the maculopapular rashes. Okay. At that point of time, we didn't know. We didn't know whether it was an infection or it's a malignancy or a non-infectious disorder. At this point of time, we revisited the history. And the grandmother at that time, she didn't tell us earlier. She said, "Doctor, my girl had 2 episodes of fainting attacks 2 months back. And we went to a nearby doctor. He took an EEG and he said it is fits. And he prescribed a medicine, carbamazepine. And 10 days after starting, she developed what I thought was measles. We stopped the medicine, but the fever and rashes persisted. Now, Eureka, this is actually a carbamazepine hypersensitivity syndrome. This is the first case report of carbamazepine sensitive hypersensitivity from India, where this case we made out mainly because we are fortunate to see a very similar case report in the New England Journal of Medicine in the clinical pathological conference. Otherwise, we would not have made a diagnosis. Short course of steroids, everything melted, child recovered. Then only we went and saw literature. Carbamazepine had just appeared 25 years back. Pseudo-lymphoma syndrome, which can be caused by your phenytoin, can also be caused by carbamazepine. So what we learned from this case is that any child with fever, what looks like an infection may not be infection, may be a drug fever, The most notorious groups of drugs which can cause fever are anticonvulsants, cotrimoxazole, cephalosporins. Cephalosporins are notorious for causing drug hypersensitivity, penicillins, beta-lactams, they can all cause. And this drug fever is a diagnosis of exclusion. You may have eosinophilia, you may not have in every case. You have to exclude infections. There is no single diagnostic test for drug fever. You stop the drug, majority of drug fevers stop in 3 to 4 days. But in conditions such as DRESS or carbamazepine hypersensitivity syndrome, even after stopping the drug, the fever may go on for 1 to 2 weeks. That doesn't exclude drug fever. So that is where the difficulties arise in drug fever. Drug fever is one non-infectious cause of fever, which is often underdiagnosed, missed, and wrongly treated with multiple antibiotics.